Complications of gonorrhea. Gonorrhea is an infectious disease, contagious one, which is transmitted through the infected sexual intercourse, whether it is vaginal, anal, or oral one. In women, there is vaginitis, cervicitis, the bacteria in ascending infection proceed over the fallopian tubes. There occurs Bartholin gland abscess. There is stricture formation, narrowing of the fallopian tube due to the inflammatory process. So there is obstruction in the passage of the germs, sperm. So there are more chances for the infertility. Then there is pelvic inflammatory diseases, due to which there is ectopic pregnancy, pelvic inflammation, and the pelvic pain that is produced by the chronic inflammatory pelvic diseases. In men, there is urethritis that produces urethral discharge. This discharge, like the vaginal discharge, is from white to pale, and then it become greenish one. It is very foul smelling, fishy smell, sticky one, and it consists of the germs, that is the bacteria, or we can say full of gonococci, that is responsible for spread of the gonorrhea onwards. One thing, that if sexual partner both are suffering already, or one is healthy and the second one is infected one, the infected one will transmit the bacteria of the gonorrhea to the healthy partners through vaginal, oral, or rectal coital process. In men, urethritis, urethral discharge, then there is ascending infection in the prostate, prostatitis, excessive secretion of prostate, then vesicle, seminal vesicles, and the vas deferens, they are also inflamed one. So there is obstruction in the passage of the sperm or the semen for outward fertilization. So there occurs more chances of infertility in men suffering from gonorrhea. Moreover, there is epididymo or coitus, that is, there is inflammation of the single testis or testicles. This pathology is usually it is unilateral, only one testicle is affected one. Rarely both the testicles are swollen and suffer this gonorrheal inflammation, which is swollen, reddened, and very painful. So these are the various complications. These are the genital complications. One, the others are termed as non-genital complications. That is, in the eyes, there is conjunctivitis, there is pussy secretions, crusting of the eyes, injection of the conjunctiva, painful eye, and if that is ignored, may lead to blindness. Next is the pharyngitis due to the oral intercourse. There is ulceration of the oral cavity. There is painful swallowing. There is enlargement of the neck lymph nodes. These are due to the oral gonorrhea caused by the oral intercourse. Rectal gonorrhea, in that case, there is inflammation in the anorectal gut, produces painful defecation, rectal bleeding, rectal pussy discharge, and there is also swelling of the around the anal apertures. So these are due to the gonococcal infections produced by the rectal intercourse. Likely, there the bacteria, when they are overpowered by the immune system, that passes in bloodstream, which is called as septicemia, and that goes into the various joints of the body and produces arthritis, polyarthritis. The joints become inflamed, swollen, reddened, painful, crucial pain, severe pain is produced. There is swelling because exudate is produced within the joint cavity. So there is also inflammation of the tendons, ligaments, synovial membrane. So in diagnostic procedure, we can also extract or aspirate the fluid from the joint and send to the laboratory for proper diagnosis to differentiate from the other pathogens causing this disease. During arthritis, there is fever, malaise, then there is anorexia, then myalgia, nausea, vomiting. In addition, these bacteria, gonococci, also affect the inner layer of the heart, that is called endocarditis, produces endocardium inflammation, and that lead to the endocarditis. Similarly, when it approaches in the brain, they causes the inflammation of the meningitis and cause in the meninges the covering of the brain material, and they cause meningitis. And the meningitis, then there is headache, vomiting, vertigo, dizziness, etc. These are symptoms produced by the meningitis. Now, these symptoms are produced by the bacteria. So, there is no appropriate or the certified vaccine for the prevention of this infection. However, there is another vaccine used for Neisseria meningitidis that is said, or it is used for prevention of the Neisseria gonorrhea, bacterium gonorrhea. But it is not a certified thing, but it may be useful as a preventive measure. But it is not the targeted or the manufactured for this gonorrheal infection.